Welcome to the Black Doctor Collective podcast. We as Black doctors are in a unique position. We can change our communities, healthcare, and the world. Of course, we start by changing the way we see and value ourselves. I'm your host, Dr. Shanika Horn, pediatrician and physician coach, travel extraordinaire. I am so happy to have you here and listening. So let's get into it. Hello and welcome back. This week we have a guest episode. This week we have Dr. Cynthia Hill, who's a family medicine physician in Charlotte, North Carolina. Originally from Petersburg, Virginia, she received an undergraduate degree in psychology from the University of Virginia. She attended the Medical College of Virginia, Virginia Commonwealth University, VCU, for medical school and remained there for family med residency. Her original goal was to become a child psychiatrist. After working part-time in a pediatric psychiatric hospital during medical school, she realized that psychiatry was not for her. Her goal was to always provide healthcare to underserved populations. Family medicine allowed her to care for a variety of patients and address health disparities. Her current role includes direct patient care and teaching residents in an urban healthcare center. She has special interests in healthy diet and exercise. Dr. Cynthia is very passionate about her work, but self-care is a priority. You know, she's speaking my language. She makes time to do the things that make her happy, like exercise, travel, spending time with family and friends. Welcome, Dr. Cynthia. Welcome to an episode of the Black Doctor Collective podcast. We have a guest episode. We actually haven't had a guest episode in a little while, like maybe a couple months. I'm super pumped about this one because me and you have been planning this for some time.
For a long time. Way too
long time. Yes. Super excited to have you because we met at NMA.
Yes. Yeah.
2 years in a row. You guys need to go to NMA if you haven't, because it is a vibe. But yes, we met at NMA and we just struck up conversations. And every time we have a conversation, it's like we're talking
long, crazy conversation about everything.
About life. Yeah. Exactly. So tell everyone, I guess, a little bit about you, your background, just so they can hear how awesome you are that I've already discovered.
Well, I am a family physician. Based in Charlotte, North Carolina. I came here in 1998 when I finished residency, started out in a private practice and ended up transitioning about 3.5 years into a hospital-based clinic. So, and there's a story behind that we can share. So what I do now is I work in an underserved clinic population, Medicaid, Medicare, uninsured, undocumented, everything from HIV to OB care. I teach residents also, which is a great part of my job. And I was in the hospital also. I did inpatient from 98 up until about 2.5 years ago.
Okay.
I finally, I held on. Yeah, I held on. I was one of those people that love the hospital. I still love the hospital, but post-COVID hospital kind of put me in a different place. I made it through that couple years of pandemic, and then it was just time. So right now it's all clinic work, and it's an interesting, crazy place to work, and I love it. So.
Yeah. I actually was just so funny. I had therapy like earlier this afternoon, and I was telling my therapist, because I was like, I just feel I'm looking for ease. That's my theme. Like, I love a soft life vibe. I'm looking for ease. And she's like, what does that even look like in your workplace? And I was like, honestly, I feel like it looks like just being in and amongst my community, right? Like being with my people, serving my people, like feeding them, then feeding me. Like, not that there won't be drama, but just being connected to community in a way that doesn't always happen.
It's very true. And I think for me, I knew when I started out, this was the kind of work I wanted to do, but finding a job out of residency, I basically took what I thought was a good job,
Yeah.
The best opportunity. I had bills. I had a lot of bills, a lot of
Is it
student
long?
loans, a lot of student loans. I couldn't take a chance on going to a clinic that wasn't well run, that I wouldn't get paid as much as I needed to. And
Mhm.
what I did is I volunteered at this clinic. I asked somebody in town, like, where's a good clinic that's doing good work? I
Yeah.
wanted a predominantly Black patient population.
Yeah.
And so I volunteer precepted with the residents. They allowed me to do that during that time. And then
Good idea.
when a job came open and I really wanted to transition out of the other job, I took it. And people
Mm,
told me I was a little crazy. I left what was considered a very nice private practice in a different
sure.
area with,
Sure.
more of a middle and upper middle class population.
Yeah.
And even my family said to me, okay, so you really want to go to the ghetto? You really trying to go to
Right.
the ghetto? But that's where my heart was. Best decision I could have ever made. So I've been there now 23 years.
Oh my gosh. That's saying something. Well,
That is
like
saying a whole lot.
immediately I'm already pulling like three lessons out of this. Like, A, show up where you want to be, where you want to end up. There's no harm in making connections and volunteering and doing work to, start to layer in the fulfillment part of medicine that you're looking for. So I'm like,
Yeah,
that's a pro tip right there. Second of all, not everybody knows what's good for you more than you, because
exactly. Exactly.
people are going to tell you no.
They are. And I got to a point in my first practice where, and this was something I didn't anticipate. So at the
Yeah.
time I got out, most people still had their own private practices. People
Hmm.
were starting to get bought up by practices. So
Hmm.
the dynamics of your contracts change, how you work changes. There's good and bad about that.
Right.
And my original practice decided to buy themselves back from the hospital. They were tired of it.
Yeah.
It didn't work. And when they did that, this is a contract tip I learned from the very beginning. When they did that, my contract was no longer, it was no longer valid.
Yeah.
So they came to me saying they wanted me to buy in
Oh,
and, or take this contract as an employed physician that was significantly less than I was making. So I knew this wasn't my last stop. All right. I knew I was in a private practice. That's not where my heart was. So I had to make a decision. And what I did, I consulted a lawyer, which I tell my residents all the time. Please don't make decisions without attorneys that know about
get
medical.
somebody to look at it.
Yeah, and somebody who actually knows medical contracts, not your
Yeah.
cousin or your brother that is a prosecutor. Like, you need to get somebody who really knows what medical contracts are in your area.
I
Uh,
love that notion because people do that with doctors, right? It's like they think, oh, you're a doctor. Let me talk to you about. And it's like, that's not my area of expertise. Lawyers
It's
are
not.
exactly the same. Don't do
It's
it.
not. It's not the same. So what I did was I went to the attorney and she sat down with me and she said, your contract negotiator did a good job, which I hired somebody going in, but they didn't anticipate that practices would maybe do this, buy themselves back. So trust me when I say I will never make that mistake again. If I do leave, all of my next contracts have had that caveat. If something happens and this entity changes, that my contract stays the same. And
Mhm.
that happens.
Huh? It happens a
So
lot.
it happens a lot. So what I had to do, she said, well, can you afford to just walk out? They've told you you don't have a contract. So that means there's no
Probably.
non-compete.
Yep.
And I had patients scheduled at that point for like 3 months. Like I was full, busy, and they didn't expect that I was going to do that.
Yeah. They were like,
So
here's your options, A
here's
or B.
or B.
And you
Yeah.
were like,
So
damn.
that's or the other devil.
Right.
So I said, yeah. Thankfully at that point, I still had a lot of student loans, but I was in a better position than I was out of residency. So I basically walked in on that Friday afternoon and said, I'm sorry, I'm not going to be here Monday
Ooh,
because you canceled my contract. And my attorney has advised me that that means that I can leave.
yeah.
So the shock, because
I'm
that's the little
sure.
black girl now. And there were only two of us in this practice of 10. And I was told later by one of the partners that he respected how I did it, that they didn't anticipate that I would do that.
Mm.
So in that moment, they didn't have another doctor yet. They thought I was just going to sign on to a building, sign on to a practice that I didn't want to be in.
Ah,
So we negotiated and I stayed for 3 months, got out of the contract, accepted the job where I am now and left,
so-
but left on good terms, because I
yeah.
said, well, you kind of mess with me, right? Like,
I was here minding my business.
I was minding my business. I was going to figure it out. And so that is the lessons in there are knowing what your contract says,
Oh, yes.
knowing how to move.
Hmm.
Sometimes you can't do it with emotion because I was mad.
Oh, yeah.
I was mad, but you have to be a professional. I stayed, I saw my patients, I saw them through the transition.
Hmm.
So I still have a relationship with them. Years later, they've referred people to me that have lost insurance or needed another
Uh,
doctor.
uh,
So we're cool.
I love the leverage that's created when you're willing to walk away. Because I have created so many opportunities that way, and it's not a bluff move. It's not something you do when you're bluffing, right? I always tell people that because everyone says, just walk away. Just like that is not the move if it's only right when it's right.
It's only right when it's right. And you got to remember, even if you go to another city and practice, another state,
Hmm.
your reputation is going to follow you. So
Hmm.
the last thing I wanted was to be the angry Black woman, right?
Yeah.
I don't want to leave that. I want to leave it as she was good at what she did. She had a great patient population, wanted to do something different,
Hmm.
was met with a choice
Hmm.
and left and made sure everything was tied up. My patients
Yeah.
were taken care of. I didn't take all my vacation at the end, which I could have.
You should
I
have.
I should
I
have
tell my people all the time, take that. Take you.
take the vacation. I had taken quite a bit, but I was not. I was good about it, so that when people have asked them about me, they've had good things to say.
Yes.
And transitioned to my clinic, and I wasn't sure, but at that point, I'd learned some lessons. So contract negotiation was different.
Hmm.
Definitely was very specific. I had a good attorney that was here, and I allowed her to do all the negotiation. Everybody's different in that. Now I'm at a point in my career that I negotiate on my own with the attorney, but sometimes it's good to have them be the bad person when you're going in. Well, talk to my attorney. She's not going to let me sign that. It was easier at that stage to have them do it since I was negotiating with a bigger system.
I would
Mm.
say well, one thing I would say is like, people do worry a lot about what you said, like leaving a bad taste when you leave a job or leaving a bad taste when you're going into a new job. And I will say, like, in your example, you still stood up for yourself and did what you needed to do and didn't like leave a bad flavor, right? So, like,
Yeah.
there are ways to find a good medium. But yeah, I think that that's like the lesson, right? It's like
Yeah.
the thing. You can find a way to still be yourself and be in integrity with your own values and also
Yeah.
leave when you're ready
And
to
leave.
right.
Yeah. Also leave. Well,
Yeah.
and you got to remember, we're still physicians.
Mhm.
So I did not want to just really leave my patients like that. It wasn't the
Right.
population I wanted to stay in, but I
Right.
still
You
had a
don't wanna abandon
relationship.
people, yeah.
No, no, I definitely wouldn't want to do that because I can't imagine, you're seeing a doctor and all of a sudden they're just gone. So
Mhm.
that's not what I wanted. And the group didn't want that either. They were really busy. And at that point in time, everybody was still doing inpatient when I first got out. That was the culture.
Mhm.
So, we were going to three different hospitals. We were busy. It would have been difficult for them, but also, like, you don't want to mess up your practice. So if you can have a good transition, it looks better for everybody, honestly. So I didn't know when I came into this position, it was the pay was similar. But when I first got out of residency, we were on an RVU model, which for people who aren't familiar, especially residents in training, it's relative value units. So basically, you get paid a certain amount of money per RVU. So a level 3 office visit, say, for instance, is 4 RVUs. A physical is, 8 RVUs, something like that's not exact, but it was definitely a productivity model.
Mhm.
Now, I did take a cut at one point after September 11th. We had a lot of people that weren't paying, even people with money, people who lost jobs or, things happen in the family. So I was on a percentage of collections there.
Uh,
That's something I would not do again. So
yeah.
a pearl,
Mhm.
because if they don't collect the money,
They
that
don't pay
means
you.
you're not necessarily getting paid, even if you're employed. So it was common back then, but I definitely wouldn't do that. And I wanted to do underserved care anyway.
Mhm.
So we've gone to product. I was salary when I first got here. We went to productivity only for some years. Right before the pandemic, we went to salary again with bonus. And now I'm on a hybrid, which works well. And actually, when I first came to the clinic, I made significantly more than I made in private practice
Good.
because, yeah, because when you're in private practice, honestly, a lot of factors come into that. You know, who gets paid, how much people are getting paid, how much insurance costs. Even though I wasn't a partner, that still factored into your money.
Mhm.
So there are benefits to having someone else sign your check. Yeah, that's not you.
Yeah.
So
Yeah. I
so
you
it worked.
I had a moment, I guess, where I was like, I just want to work for myself and everyone should be an entrepreneur, but that is not everyone's story. And let me tell you, being an entrepreneur is its own struggle. I no longer believe that being employed is the same thing as safety because anything can take at any time. But like when you're growing up, it's like you need to get that job, a nice, safe and secure job, like
Yeah,
it's almost like
yeah.
government jobs used to be the thing. Like that was the ultimate pinnacle of
Until
job
today.
security
Yeah,
until this month, like until January.
yeah,
Like
yeah,
that was a thing. Like you just had this notion in your mind that this was job security. Like you get a job and someone pays you and that's that. And so
yeah.
like I've dispelled that from my own mind, but I'm like, there are definitely merits to being employed.
There are, and I say that to residents as we're talking about they're getting to their third year and they're thinking about what they're going to do.
Mhm.
Think about what you want your life to be. Now,
Yeah.
when I came out, the goal was to do the grind because I had student loans to pay off. And at that point, there were no programs for it. Like nobody was paying anything back unless you did public health services. And I couldn't find anything that was good for me. And I tell them, yeah, if you want to grind, if you decide this is going to be your job for, 3 or 4 years so you can knock out whatever, but if you're about to get married and you're thinking you might want a baby, in a year, or you want to do something else, think about things like your leave, your medical leave, your maternity leave, your family leave. Like my first year in practice, my parents passed.
Mm.
So it was a really difficult time. I was glad that I was employed and had that contract because I could take that time and not worry
Yeah.
because if you got to keep the lights on, if it's your own business, I have seen physicians say, no, I had to get back because, I had to take care of my practice. And it's great if you own it and you love it and that's what you want to do. But you really have to think about what do I want to do later
Yeah.
and what's my plan for later.
Yeah. I think you like for that, I would say also you have to be very conscientious about how you set up the structure of things because you need to have a contingency plan. Like it cannot be just you in a book. That's why like there's multi physician practices, right? Because like that's the benefit of it.
I just had that conversation. We interviewed one of our residents that took the job for my group. And I said to her, I said during the interview, if you don't take this job with us, then she's a great resident. I'm glad she's coming. But I want you to think about this because I knew she was looking at other places. I said, do not go into practice where it's just you and 2 or 3 APPs,
Hmm.
even if it's only one other doctor and you're managing people. First of all, coming out of residency, you shouldn't be the one managing the APPs. You really shouldn't. And two, if you're going in and it's just one other person,
Hmm.
what happens when somebody gets sick or
Right.
somebody's kid's sick?
Hmm.
So how are they sharing call? Now, if it's one other person and you guys share your call and share responsibilities, but the problem is, even if you share call, that day to day
Oh,
is what gets you. The FMLA, the forms, the work notes or school notes, that stuff drowns you. So if you don't have a structure in place for that, it may look like it's an easier like, oh, it's only, 4.5 days and
yeah.
you're off. But when you're off, are you off? That
Yes.
day off,
My
does
God.
somebody expect you to be checking your
Mm-hmm.
inbox? Is somebody expecting you to be doing your refills? If that means that you're not off
Exactly.
and you don't get paid for that time.
No.
So
Yeah.
think about that.
All of the considerations, because that's one of the things I always say. Like, I just did a post the other week that was like, don't sign your contract like an Apple agreement. You just click like accept at the bottom. You just like, because you're not trying to read it, it's long, or
No,
you're like, all right, but
yeah,
all of these little caveats, and most of those things are not actually in the contract, which
they're
is
not.
what I love. I'm like, contracts are so vague.
They are, but they don't have to be. So here's
Oh,
the
they
thing that
don't.
they don't. And here's the thing that a lot of people don't realize. Everybody is going to tell you this is the standard contract, especially if you sign with the hospital system. This is
Yes.
the standard contract. We don't change this. Everybody gets
Mhm.
this contract.
Yes.
That is true, but a lie.
Yeah.
So, what I have learned over the years is that many people make addendums to contracts, including myself.
Mhm.
So you will have things that they can add in appendix A, B,
Huh.
C, and D, which many
Definitely.
of us have. Many of us. So yes, the body of the contract, some of the basics like your insurance, malpractice, a lot of those things are going to be the same.
Mhm.
But you can advocate for more or different things in the contract.
Yes.
So that's the part. And a lot of my residents will say, well, everybody's getting this contract. Yeah, they are. But what I learned over the years, especially, I think some people don't think doctors are going to talk to each other. Of course we are. Like, how much money did you get? Like, did you get something out? Like, what else did you get? And I'm going to see somebody else. Well, she's working a day, somewhere else doing sports medicine at a school, or they're doing something different. So, okay, what's the deal here? Well, somebody has negotiated for something different. Don't assume that you have to accept the first contract that comes to you. And you know what? If they say they don't want you because of that, you were not going to be happy.
No.
So,
It's
yes,
the sign. You're looking for red flags in everything but your job contract. Look for the red flags in the job contract.
yes, look for the red flags in the job
And
contract.
then the whole negotiation process. Like,
Yeah, and make sure that attorney, and this is where, and my brother said this to me when I first got out, because I was balking about how much the attorney was going to cost. And
mhm,
he said, look, Cynthia, put it on a credit card. This is worth a lot of money. And he's an engineer with a law degree. So he had a different view of this. He's like, yeah, it's a lot. And I was fortunate. It was a company that all they did was medical contracts.
mhm,
So they allowed me to pay them later. They allowed me to pay part of it. And then I paid later.
mhm.
So they were the ones in charge of knowing exactly what was in the contract,
Yeah.
which was key for me, and doing the interpretation and saying, no, this doesn't sound right. We got to change this. These are the things that probably can be changed. So yeah, don't just click on the Apple contract. You're
Oh
going to
my
end
God.
up giving up your firstborn
Right.
like an ovary.
Yeah. So like part of like my coaching is that I go through the contracts with the doctors, and I'm like surprised how many people haven't read it. Or they like kind of skim it and they get like the gist. But then when I start asking them questions, they're like, oh, I don't know. Cause I ask them exactly that, like with a schedule, right? I'm like, oh, this is great. Like you only have to do call such and such. But like, who's on staff and what happens when they go on maternity leave or they quit or they whatever? And they're like, oh,
Yeah.
I don't know. I'm like, yeah. There's so many questions you have to be asking yourself.
You do. And part of it is also, and a lot of people make this mistake, not really asking enough of the physician group.
Mm.
Why did people leave? How many people left? Trying to contact that person. Like I've had people kind of contact me on the sly about someone or something.
Mhm.
And I think doing that homework, finding out what the culture is.
Yeah.
My group is predominantly Black female. We are friends. We take care of each other. We're very much into work-life balance. So tomorrow's my day off. I work 4 days. I am completely off.
Yeah.
Now we know each other. So yeah, if something comes up, somebody dies or something crazy comes up in a lab, of course, we're going to text each other like, hey, can you help me out? Like, something's going on with this patient. And we all have established that we're good with that. But am I doing messages? Am I doing refills? Any of those things? Absolutely not. But that's the culture in my group.
Right.
I know other groups where
Every man
they
for himself.
expect
Mm-hmm.
they expect that they are working on that day. So when you come out as a resident, you're like, oh, this is great. I'm only working this amount. I'm not in the hospital. But if you're responsible for that pile of stuff or patients messaging you
Yeah.
in the middle of the night, and somebody expects you're going to do it on your day off or your vacation, and some people actually do that. So talk to them about how do we do call? Let them send it to you in an email
Yeah.
so that
Right.
so that you can go back and say, okay, this is what we discussed and
Mm-hmm.
get an idea. If they say they don't know or we all cover our own stuff, if they're not willing to change that, I would not do that. Because you're going to be exhausted. That's what kills us is the in-office work a lot of
Yeah,
times.
it is. It's all the admin stuff. It's like the duties. That's the part that's so unfulfilling too, right? You spend all this like extra time. It's unpaid. It's not fulfilling. It is so boring. And then that's the part where people are like rude to you about it too, because they're like, "You didn't respond to me. You're like, oh,
What? Yeah.
yeah,
What are you? Yes. And that's the thing. If you don't have an understanding of how they do things, how they cover for each other, also what their staffing looks like.
yes,
Since COVID, it's been very hard to keep good nurses, at least here. I don't know what it's like everywhere,
everywhere, everywhere,
but it's a challenge. So, do you have nursing tests? Do you have a nurse that's answering these calls initially or
right?
message it?
Mm-hmm.
Or is it just the doctor? Those are
Yeah.
things as a resident you really don't worry about much because you're coming to clinic, you're seeing your patients, you're answering some messages, but it's not all the
Right.
time.
Yeah.
So it's something to work out before you sign.
Mm-hmm.
And if the physicians are looking exhausted and they're telling you they work every day,
Red
don't.
flag.
Yeah, red flag. Because you got to get those notes done. You got to get your billing in. You have to get all of those things. Yeah.
So many things to do and not enough time to do it.
That is my other thing that I always say to people. Make sure that you know how you get fired, how you get paid, and how you can quit.
Mm-hmm. You are
So
speaking language. You're speaking my language.
those are the three things. So
Yes.
if you're looking at a contract and the math is fuzzy, we've done a lot of math as doctors.
Mm.
So if I don't understand how the math works, if that bonus seems to be based on everybody else's performance but mine,
Right. People are counting the cash. And I'm like, okay, but what do you have to do to get that and to keep that? And is that the price of your freedom? Because if you decide to leave,
can I leave? Are you going to cut my whole foot off?
right, like because some of these sign-on bonuses are like 30 grand, and it's like, that sounds so lovely,
It does.
but it's also the cost of your freedom if you leave in less than a year.
Or sometimes it's
More.
more.
Yeah.
I just talked to a doctor that's an older physician, but really didn't pay attention to that. And the job is horrible. And I want to say hers is like somewhere for like 16, 18 months because it was a large bonus.
Yeah.
So here's the thing. If you get that money, if you can afford to just save it, then that's fine. If you can save it during that time,
Yeah.
save the money, put it in,
High yield
don't
savings account, something.
exactly, exactly. So that if you decide to leave early, you can give it back. But
Yes.
if you know you're going to spend it and you got to stay for like a year and a half, you got to really think about that.
Mm-hmm.
And I think a lot of residents coming out,
Mm-hmm.
they're they're going to use that to pay for their wedding. Like,
Yeah, they're gonna put a down payment on a house. They're
on
gonna
a house, and then
yeah.
you're stuck. So definitely knowing how you get paid. And once that guarantee is over for that first year,
Mhm.
Then what happens?
Mhm.
If I'm not making my salary, do I owe you money?
Mhm.
And a lot of contracts, if you didn't make that money in that first year, if you weren't pumping out the patients,
Yeah.
you may end up owing them from your base salary the next year.
Yeah. I find they try to lull you into like another false sense of security. Like a lot of these contracts, a lot lately, especially depending on the state, are 3-year contracts. So they'll tell you, I know such a long time. I'm
I
like,
haven't seen
I
a three
like you.
contract.
Like
Yeah, usually two.
tons of 3-year contracts. And I'm like, I don't even know if I like you yet. Like, you want a 3-year commitment? But then they'll say stuff like, it switches to an RVU or a productivity model at the end of the second year. So they will let you get real comfortable for 2 years working in this job, and you have no idea if you're going to be able to meet the metrics. And then year 3 comes, you're in this agreement, and now they switched over your compensation model. Like, you know how hard it is to transition out of something you just got comfortable in for 2 years? And then
Yeah.
you're like,
And that's why the one thing that the attorneys told me when I first came here and we were doing RVUs, because I didn't know what they were,
mhm,
is she made them send all of the
yeah,
information about take 2 or 3 of the doctors without their names on it, show us what their average RVUs were,
mhm,
show us what the average patient population was, and
mhm,
also how much you made per RVUs.
yeah,
So, and making sure I had patients to fill that schedule. Because
yeah,
if you're going in,
new,
it's one thing if you're filling somebody else's position, because then you know you've got patients. If they're not marketing you and you go in and you're in an area that's more difficult, you may not make your salary. And by the end of that second year, if you're not making your full salary, are they going to take money away? Because I do know physicians that have had to pay back.
yes. Or they're not calculating your RVUs correctly.
Oh
I've
yeah.
seen it all.
Yeah, people laugh at me because I'm the keeper of all the documents. So
Right. Me too.
I have paper documents from 15 years ago that
I
when
have
you
documents for my documents. Okay.
right,
Like,
exactly. Exactly. So, yes, if the calculations are off, if something, make sure you're paying attention to how you're billing.
mhm.
And sometimes depending on your residency, they may not be good with teaching you about
My
billing.
residency did not teach me anything about billing. And then I did locums for years, which I also just didn't worry about billing. And then I got into some smaller practices, even through locums, some smaller practices that were like, you're billing. And I was like, I don't know what you're talking about because I never had to do it.
So that's why, like, part of what I was doing before I was leaving today, like when we finished the end of the day, we go through their
Mhm.
billing.
Mhm.
Okay, should this have been a level 4? Like, what did you actually do? Is this a level 5? Can we get that out of this? Did
Mhm.
we bill for everything we need to? So that's part of my precepting session with
So
residents
good. I don't know.
is billing.
Oh, attendings out there, if y'all are listening and y'all are training residents, please do this for your people because
Oh, yeah.
hold up, it does not happen.
And when they get out that first year, they're billing everything like a level 3. They don't recognize how much work, because sometimes residents would do that. That's why we go through billing again at the end of the day. And then I'd look at the note and be like, you did all of this? Like, what are you talking about? Like, I'm thinking it was just a sore throat, but the blood sugar was 400 and the blood pressure
Right.
was like,
Right.
no,
Right.
no, this, and we will adjust. So when they send me their billing, we will adjust. But I try to do it before I leave clinic so we
Yeah.
can kind of talk about what they did in the visit.
Oh, that's
Um,
like invaluable experience right there. It's not happening in most places. I can tell you that.
so you get out and your money now is based on this and your bonuses. A
Mhm.
lot of places
Ah,
now, your quality measures are a part of your bonus.
yes.
Well, we've had some issues with that because I'm in an underserved population. My patients want mammograms, they want colonoscopies, but there have been times that we've had to fight to make sure that they can get those if they're uninsured.
Mm,
So, knowing how much of a percentage that is,
yeah.
because it's not because I'm not ordering these things, it's because
Right.
some of my people can't afford them.
Yeah.
So, you've got to adjust when you do your contract depending on what your population is, because you'll get dinged for not doing things for people. And if it's a large part of your money, that's not good. So,
Oh my goodness. There is so much nuance to contracts and to like understanding. your value. Honestly, I think this is why they don't teach us this stuff because they don't want you to know. Like, this is the kind of money you're bringing in. Most people have no idea how much money they're making in institution.
Yeah, I think some of it, though, as physicians, I think part of it is we go into it thinking just about the medicine.
Yes.
And I do want to mainly do that. I
Of
really,
course.
you hate to think about the politics, you hate to think about
Sure.
Medicaid and Medicare guidelines and all those things, but it's necessary. So
I want to
that's,
own a luxury mansion. I still have to pay property tax and I still have to have homeowners insurance and I still have to get a contractor to do the things. Like the
yes.
nice thing comes with some responsibility.
Yes, it does. It does. So I think as we're going into these jobs, one, we got to train residents about this
Yeah.
as they're leaving. Like, what are the things that, especially if you're going to be in a practice that has Medicare, for instance,
Mhm.
so many nuances to billing and what they'll pay for. So teaching them those things when they leave so that when they get out, they can be successful and recognizing, yeah, you are making a lot of money for these people that are counting the coins.
Mhm.
So recognizing that is your value because
Mhm.
the numbers that they run are your numbers.
Yeah.
So there's somebody crunching your numbers and getting paid a bonus for the numbers that you bring in. So we just have to be more mindful of that as doctors. I just think it's probably not the way that we're made. It really isn't, but we're smart.
Right.
So
We figure it out.
we can figure it out. And honestly, we do quality care. I used to fight against this having to, like what I call checky box medicine. Like, why are you making me check it in a certain place? Like, I
Yeah.
said I did the foot exam. I said I did, I did the immunizations. Like, I asked about development for children, but I also want to get paid for the things that I do.
Mhm.
So
I'm putting
that
all of those diagnostic codes in the bottom. I'm like,
put them all in. Like
yep.
we need to. When I talk to you about grief and depression, you lost your family member, I do need to put those things in. Like those can't just be random conversations.
Yeah.
And it doesn't mean that we're not overcharging somebody, but when I gave you something, a handout about counseling and told you where to go,
Yeah.
yeah, that's important. And those are things that you can get paid for and insurance companies want you to do.
Mhm.
So it's a different way of looking at it.
I was gonna say, you might have to do a whole episode just on improving your billing and coding. Like at this point, we
Now
can
that
do coding tips.
yes, because people are they miss a lot of things. And,
Oh,
as they're, yeah, I mean, some of the things that people are paying for, you're supposed to do depression screens each year or more often. And some people are not actually coding for those things. And then definitely, if somebody has depression or anxiety, you're supposed to code for that and you're testing for that. But yeah, there's a lot of nuances that I think people miss. If you're in your own practice, you're probably better about it. But if you're
we
working for
have to
somebody
be,
else,
right?
you do. You
Yeah.
do. So yes, we could do a whole nother discussion about that.
We're gonna have to book that because I know people will be like, oh my God, I need to know all of these things, right? Just there is just such a breadth of information to know and understand when you are at the beginnings of your career, you know?
Yeah. Yeah.
Okay, so I feel like you knew what to do in that transition. You obviously struck gold because you've been there for 23 years, you said?
Yeah.
Right.
Yes, that's a long time. I
That's a long
recognize
time.
that's a long time. And I'm only 20.
Right. I mean, you've been there since you were 2. Like, you really nailed it as a toddler. So, like, I mean, I have so many questions. I'm like, what do you think was the thing? Like, what is the
What
magic?
was
Like, really, I guess the core of that is sustainability because, I think first of all, Black physicians are what, like 2% of the population? Like, it's like
yeah.
Black women
Yeah.
are 1 point something percent of the population
Yeah.
of physicians. And I know that people get burnt out, people get tired, and people get jaded, and all of these things can happen to you over the course of your career. And
Yes.
so I think my personal commitment to physicians and the physician space is to help promote sustainability? Like in your version, reflection of things, what do you think has made it sustainable?
Honestly, the main thing is that this is the type of work that I always wanted to do. So
Mm,
this was my calling to start with. I
okay.
did know for sure that I would end up with residents doing teaching,
Mhm.
but I knew that my goal was to be in this type of population. Even though my clinic is in an area that's now gentrifying, so things are changing, the core values are the same.
Yeah.
And I have to say, for all of my partners, it's the same. So we want to take care of these patients. These are the people that we want to be with.
Mhm.
So the other stuff makes it hard. I mean, I'll be honest with you. The political things, the political climate right now,
Oh my God.
worrying about some of my people that were able to benefit from a Medicaid expansion, that's probably going to go away in North Carolina. So trying to figure out how to do it. So that's stressful. The
Yeah.
hospital system has changed multiple times. So we've had to deal with a lot of stuff. But I think what's also sustained me is that work life balance is important for my entire group.
Yeah.
So there have been times that one of my partners may say, like, hey, you all right? You need to take a day. You need me to take call for you. Like, we've all gone through things. People have lost parents, kids going through something, divorces, there have been all sorts of things. And we all pay attention to each other.
Yeah.
So that is a big part of the key for me staying. The entire system doesn't really care about you, right?
No.
That's wherever you are. Like they don't care about you as an individual. We also have promoted, like a lot of us that have been there for a while. I've changed my schedule over the years. Like I said, when I first got out, I was still doing the hospital for up until 2.5 years ago. So that was
Yeah.
a long time. I did the hospital from the time I left in 98 to towards the end of 2022.
Mhm.
So changing that and saying, okay, it's time to come out of the hospital now. COVID has made it crazy. There's no staff. I'm exhausted.
Mhm.
I'm not loving this anymore. I've also adjusted. I went to a 4-day work week a while ago.
Mhm.
And so 4 days for me looks like I have 3.5 days of patient care and a half day of precepting. So that's a good balance for me. That has really helped. I'm still looking at probably the next couple years or so transitioning into doing something a little different, maybe cutting back a little bit more,
Mhm.
doing a little more virtual care. And I think doing different things also, like I did virtual hospital during COVID. So I have that skill set. I know I could do something else too. Sort of listening to what I need and when I need it
Yeah. And responding to your own needs.
and respond. Yeah. Yeah. And I do a lot of other stuff. Like I love to travel. I work out every day. I have a lot of other things that I do that are not work related.
Yes. The
So
actual balance.
I definitely have a balance. So that is important. And my partners support that.
Yes.
Like they're all like, oh, hey, where are you going? You going out of town this weekend? That's great. You need me to take care of something so you can get out of here on Friday? I got you. Like that's what we do. So choosing the right people to practice with, that's a hard thing.
Oh my
But
God, it's so hard.
but it's like a marriage.
No,
It's
it is. And that's like, it's funny too, because if you're working in some of these bigger things, you don't pick the people you work with. It's like showing up to like depends on the place. And I also say to people, like, that's not a reason not to pay attention to the contract and all the things. Is that, oh, you liked who you met on interview day? Because you don't know how long those people are going to stay there. And you also don't know anyone's real personality until you've been there a while. Right. But like,
yeah, that dating stage. Yeah.
yes. So I'm like, there's just so much complexity to choosing the job. It's like, yeah, if you can find that right mix, this is what I'm hearing you say. If you can find the right mix of serving a population you love with people who have similar values, kind of styles as you, then even with all the changes, you can navigate those as they need to, as
Yeah.
they come, right? And also being really flexible to your own needs and your own values, right? And those
Yeah.
change and evolve all the time. So all
Yeah.
of those things change and evolve.
Yeah, they do. They do. Your life changes. Like you
Yeah.
don't know where you're going to be or what's going to happen with you in the next few years. A number of my partners now are kind of in that sandwich generation. They have kids, but then parents are getting older.
Okay. Yeah.
So, people are kind of talking about, what do I do? How do I do this?
Mhm.
And it's okay to say that I don't have to work like crazy.
Yeah.
And I think
Not
the
feel bad
culture
about
when
it.
I came out was you just didn't say that.
Right.
You just put your head down and worked like crazy. And my thing is, I want to practice with people who are smart. I want people. Now, I'm not going to leave a mess. Like, I have some stuff from today because I was trying to get out of there. I'll text my partner that's on call tomorrow and say, hey, I left some stuff in my in basket. I got it. I know I wouldn't normally do that to her. So we take care of each other in that way and check to see how long people have been there. Like, when you're interviewing, ask them pointed questions. Because I would be honest with people. Like, when we interviewed just recently, we talked about some of our issues in the office, like with handling forms and paper and front desk. Hey, we're working on this, but
Mhm.
these are some of our issues right now. But this is what we're doing to change it. But if everybody's disgruntled and people are looking, or they lost 3 or 4 physicians in the last couple of years,
Mhm.
you got to really think about that.
Red
Uh,
flag.
it is. And some people, I get it. You just need a job and they'll give you a year. You got to do it and then do it.
Mhm.
But if everybody's walking out and you can tell when people are happy when you
Yes.
go
Yeah.
to
Yeah.
you really can. And how they interact with each other. Like, if you're
Mhm.
in an interview and see how partners interact with each other, it tells something.
It
So,
does. Yeah, for sure. For sure. I mean, I like all of these nuggets and I keep pulling them out because I really want people to hear and appreciate it. That it's just this constant evolution, constant balance, but like your people, it's always about community. And like another conversation I was having is like we live in this society that is so based on like colonialism and individualism. But actually, community is the thing that actually makes all of this survivable and like tolerable. So, like, both your patient population you mentioned and the population of people you work with are the things. Yeah, just like really leaning into community in that way.
yeah. And remembering you are the doctor. Like, I think sometimes we've gotten lost as you hear the horror stories about physicians that do get fired,
Hmm.
or, things happen to them and they're not treated well.
Right.
Well, you're still the doctor, and there's still going to be a place for you, but it's probably just not that place. And I think the things that doctors get fired for typically, I mean, if you don't get your charts done, if you're not doing your billing, but we also know not everybody gets fired. So
Right. I was gonna say I
there
know
are
plenty
some
of people
people
who don't do their charts and they do just fine.
who don't, yeah. And that there are people that get treated better
Hmm.
and people who don't. So, making sure that you're conscious of that and the group that you're in.
Yeah.
So it's tough, but I think being a doctor is still a pretty great thing.
Yeah. I think if you find it, because it can really exhaust you and it can really deplete you. But if you
Yeah,
find, again, you really have to be true to yourself and like what you're looking for and your values. But if you find that thing, it's so good.
it is. It is. And it's okay to come out and say, okay, none of these contracts look good. I'm going to
Mhm.
do like you did. I'm going to do locums.
Yeah.
I'm going to do urgent care. I tell people that. Do that so that you can get out of it. Don't just sign a contract because you think that that's traditionally what you have to do.
Right.
Some of our residents have gone on to do other things like weight management or cannabis, or
Anything.
other. There are so many other things that you can possibly do. So don't feel like, oh, everybody's signing a contract to do this and I've
Mhm.
got to do a traditional practice. That doesn't work for everybody.
Good.
Keep your skills up. I wouldn't recommend that somebody come out and just automatically just do virtual care only,
Yeah.
just in case they want to continue to see patients
Mhm.
later. Do a hybrid, maybe do at least a couple of days of patient care, a day or two, to keep their hands in it.
Keep your
Um,
options open.
Keep your options open. Yeah. And I think if more people did that, they probably wouldn't burn out. But I mean, I've definitely been burnt out a few times. I mean, I've been doing this a long time.
Yeah.
I've been through burnout and come back from it.
Yeah.
Definitely COVID, the being in the hospital during COVID, definitely, yeah, that was a rough time.
Can I just say, like, as an early career physician, like, we have been through the corporatization of medicine. We have been through a pandemic. Now we're going through the fall of Medicaid and Medicare. We're like, it's a lot.
It's a lot. It's a lot. I know. It's hard. It's hard to be a Black woman, and it's
Oh my
hard to
God.
be a doctor. Yeah. Yeah.
Right. At
It's
baseline, it's hard to be a Black woman generally.
fine.
It's hard
At
to be a Black
baseline.
woman physician. It's hard to be a doctor separately.
Separately, yes. But I will say with this, and I know we're not going to, this isn't a political talk, but I did decide
Discuss
with
anything.
this time, yes, with this time that I was going to protect my peace more than I did in previous elections and do all that I could.
Yeah.
But that's all I can do.
Yeah.
And I do have patients that I know are going to suffer and are suffering with this, but I cannot save everybody.
Yeah.
Now, I push people to vote.
Yep.
Try.
Yep.
I'm not even supposed to be doing that. But
Right.
I, in my office, telling my young people, okay, you're about to turn 18, go ahead and register, do those things. But as a doctor and as a Black woman, I had to say, okay, I got to protect me first.
Mhm.
So I'm just going to do what I can do. And I'll save as many people and care for as many people as I can. But I can't I can't let this keep me up at night.
Right. Yeah. That's like my motto. I'm like, if I feel like I'm doing my best, even if the result is not necessarily what I want it to be or what I had hoped for, if I am doing my best, I'm just going to make my peace with that.
You have to. You have to. And I think, this is a difficult time for us. And we're kind of waiting to see what happens next for
Yeah.
healthcare. And I know a lot of the programs that my patients use, even the educational programs for my patients with special needs, my kids.
I'm like,
I
wig,
know,
snap, like maybe like food, everything,
food,
patient food, like it's
yes,
all intertwined.
it is. It is. And all of those things are important for our people. But maybe this is a time where this has to impact people,
Yeah.
to make a change.
Right.
So, yeah, it's a difficult time. So I try to like just stay immersed in getting the medicine done. And I still do a lot of social stuff with patients because of the population.
Mhm.
People are homeless and without insurance. And, I just do whatever I can in the day.
Yeah.
And I work with social workers and I say that all the time. I'll say, I'm sorry, doc, I can't find housing. There's nothing. I'll
Yeah.
just say, you know what? We're going to do the best we can. You tried,
Right.
and that's all you can do.
Yeah.
So,
It's so good.
yeah. And it's only March.
We talk about it. Oh my goodness.
I know. I know. Plan your vacations. Plan your
Oh
vacations.
yeah. I'm already my vacations stay stacked because I have to like pace myself.
Oh, yeah. We got NMA to do. So it's
Mhm.
going to be in Chicago. So that's going to
And Chicago's a great city in the summertime, y'all. So just start.
Yeah, my family's there. So
Really?
yeah, yeah. I'm from Virginia, but my brother and his family are in Chicago, so I'm there all the time.
Okay, well, we do have to wrap up, but I feel like we have so much more to talk about.
We do. We got to do this again.
We have to do this again. Like, I feel like we could crank out a couple more episodes because we have to talk just about billing.
Just about billing. I know.
We didn't even finish talking about life because there's
Yeah,
just so much.
I know. There's a lot of stuff. There's a lot of stuff. So yeah, we could definitely do billing. We could do some more things about contracts and all of
Yeah.
those
Oh my
things.
gosh. All
Yeah,
okay, perfect. So with that being said, I mean, we're Instagram friends. Is that where people can find you?
they can. So yes, see Rochelle A.
Yeah. We'll
So
put it in the show notes.
yes.
You guys can just click the link. It's like the easiest thing ever. Just click and follow us.
Yes, yes. So that is good. Actually, I just gotta text her. I'm going to have a student from my college, a young Black woman that is pre-med at UVA that is going to shadow me over the summer.
Oh,
So
so
I'm
nice.
excited about that. Yeah. Yeah. So it's going to
It's
be
like
fun.
all those, like I said, it's all those little moments, those community moments. So yes, that's what we're doing. We're building our community. So you guys can go follow on Instagram because we are building community, demonstrating our connectedness, and just we're allowed to do that. And this is actually the only thing that's going to help us survive this apocalypse
Exactly.
downfall
Exactly.
of the healthcare system. So
Make the right contacts with the right people that can lift us, that can lift
yeah,
us, help
exactly.
us grow. That's what it's all about.
That's everything, honestly. That's what carries us forward. So, okay, don't say I didn't help y'all connect to a person, okay?
Yeah. We're going to keep connecting. We're going to do this
Yes,
again.
it was such a pleasure. It's always a pleasure chatting with you.
Yeah. So until next time.
Until next time, thanks for listening, everyone. Have a good day. Hey, I just want to take a moment to talk to my early career Black doctors who listen in, especially if you feel like something at work just isn't working. Maybe you're not being paid what you deserve. Maybe you're constantly stretched thin or not sure exactly how to say no without backlash. And maybe you're wondering if you should just leave medicine altogether, because at this point, who knows? If any of that feels familiar, I created the Any Day Negotiator Group program for you. This is my group coaching experience where we take everything you've been taught about being grateful, about not ruffling feathers, about waiting your turn, and flip it on its head. We talk money, we talk contracts, we talk boundaries, but most importantly, we change how you see yourself and what's possible in medicine. Because what if you actually enjoy your job? And what if you could ask for what you need and get it? What if you could stop questioning your worth and start walking in it? I've had clients negotiate 5 and 6 figure raises, get leadership roles they didn't even think were on the table, including me, and completely redesign how they work without working more. That's the key. My next cohort launches in May, and I want you to be a part of it. If you're ready to stop tolerating and start choosing, head to the link in the show notes for the sign up link, and you'll sign up for a call with me where we talk about what's going on in work and figure out if this program is the right next move for you. Because you don't have to wait for a job change or some big moment. You can start negotiating for what you want any day. Why not today? Thank you so much for listening. Please subscribe to the podcast. And what I want you to do next is link us everywhere you can. Instagram at The Black Doctor. Just become part of our collective. I want you here. Thanks. Until next time. Bye.